Let's Cover That podcast is brought to you by CM&F Group, professional liability services for over 200 healthcare professions. Visit our website at cmfgroup.com/podcast for more info.
Hey everybody, Will Sullivan here with another episode of Let's Cover That with my co-host
Antonina Agruza. And today we have with us Brian Taylor, Senior Director of Audiology at Signia. Brian, thanks so much for joining us today.
My pleasure to join you.
So Brian, tell us a little bit about your background in healthcare and what led you to Signia.
Well, I am an audiologist and I've been one for more than 30 years now. It's a profession that works with people with hearing loss, mainly identification and treatment of hearing loss. In my career, I've worked primarily with adults with age-related hearing loss. And for the first half of my career, I worked in the clinic where I did a lot of assessments, treatment, and fit a lot of hearing aids, transitioned into industry over the last decade or so. And I've always been sort of fascinated by the evolution of technology, especially in the digital era. And so now I work kind of bridge what happens in research and development and what happens in clinical practice. So that's sort of been my role over the last decade or so in the industry.
Yeah, so Brian, kind of that bridge that you're making. So bring us into Signia, like who are you all, and like what's the work that you're doing, and how do you differ from what's in the marketplace?
Sure. Signia has been around as a hearing aid manufacturer for more than 50 years. Until 7 or 8 years ago, it was known as, it was a division of Siemens, which I think everyone is familiar with. For various reasons, Siemens decided to move out of the hearing technology industry. The company was purchased by another group out of Denmark, and now we have the name Signia. And as far as like what we're known for, there's several other manufacturers in this space, as you probably would imagine, that are competing for business. I think what kind of separates us is we have a clear devotion to signal processing that helps people in background noise. Background noise is the leading problem that people with hearing loss have. And so as a manufacturer of hearing aids, we've devoted a tremendous amount of resources to trying to improve algorithms that help people hear better in background noise, which is the most common problem, the biggest challenge. And over time, I think we've really brought to market some really novel and effective ways to improve speech intelligibility in noise.
So Brian, how do you feel that the technology is impacting the healthcare space and driving better patient outcomes?
I think that the technology has, for various reasons, has improved immensely over the last decade or so. We're it's just like everything else in the digital world, that things happen incrementally, sort of around Moore's law, where you see the doubling of computer capacity and memory every 12 to 18 months. The same thing has kind of happened in the hearing aid world. And I think what you're starting to see now is that some of these more advanced features that link the hearing devices to the smartphone and to apps, for example, are really not only are helping people hear better in background noise, but they're also having an impact on quality of life, like a person's ability to socialize, to be more physically active. I think that you're starting to see some real breakthroughs in the way hearing aids, hearing devices writ large are helping people just maintain a better overall quality of life as they age.
So Brian, kind of getting into that, when you're distributing out the hearing aids, the technology that you're doing, how's that work with the patient, and how's that kind of juxtaposed with how you're helping hearing professionals grow in their careers and their businesses?
Yeah, well, that's a big question because there's been some pretty monumental changes in the way hearing aids are dispensed and distributed over the last year or so. So traditionally, Hearing aids are a medical device. They just got the new label of prescription hearing aids in the last 6 months or so. And a prescription hearing aid needs to be dispensed by a licensed professional. And that license is held by somebody at the state level. So in order to dispense hearing aids, you have to be licensed in your state to do so. But in October of last year, a new category of hearing aids was brought to market called over the counter, which are uh, regulated by the FDA. The intended wearer is somebody with mild to moderate hearing loss, and they can buy the hearing aids without seeing a licensed professional. And my company partners with Sony to bring this this type of hearing aid over the counter to market. So we believe that over the counter can kind of stand side by side with prescription hearing aids. It offers patients, people with hearing loss, a choice. I have to say, in my opinion, the vast majority of individuals with hearing loss benefit from seeing a hearing care professional, that's a necessary part of the equation. But there are some people out there that want to opt in and try hearing aids without having to make an appointment, without having to see a professional. And if you're maybe on the younger side and have mild to moderate hearing loss, that's a perfectly acceptable alternative.
Is that something, Brian? Just curiosity. You've heard some uptick about tinnitus, for example, and some other issues as we've kind of moved through COVID. But juxtaposing that with you all, have you seen an increase of people wanting to really demanding and desiring the over-the-counter option because they don't really know what's going on, but they want to kind of test out, see if there's a quality of life improvement before they
Well,
go to the licensed hearing care professional?
I don't think there's an uptick. I think that it's a relatively small group of the population that wants to kind of try it on their own, dabble with it first, maybe before they go in and make an appointment. What I've observed, and there's been a few studies that I think also support this. Most people want to get a hearing test first and look at their options before they make a purchase. And that there's one study in particular that I know comes from Northwestern University that says that most people prefer to get a hearing test before they look at what their treatment options might be. And it's also linked to age, meaning as the older people are, the more likely they are to want to get a test before they start exploring what their device options might be. Um, and I've observed that as well. I think most people, even though over the counter has been around for about 6 months now and people are kind of curious about it, they still know that this is probably this is something that requires some expertise to kind of navigate the options. And I think, that's important for consumers to know that there are experts out there that can kind of help them decide what might work best for them.
Yeah, that's really cool. I was actually looking at your website and I saw that, a lot of your products actually have an app that connects to them. So in the way of, how these new over-the-counter hearing aids are working, what is the point of the app? Is it just for the patient, or does their audiologist or other hearing professional have access to that as well?
Well, that's a great question. Let me be really clear. The over-the-counter hearing aids are branded with Sony, and they're not nearly as sophisticated as the prescription hearing aids you would buy from a licensed professional. So the apps we're talking about really only are something that you see with the prescription hearing aids. That being said, those apps, they do a number of different things. They allow people to kind of track activity, like how many steps they take, how much they talk. And that's really interesting because there's some data out there that would suggest when you restore somebody's hearing, they become more socially active. And we can actually monitor that and track that with how much a person talks. And then how does that work with the hearing care professional? Well, when somebody visits the office or they log in remotely through the internet, they can pull up their hearing profile through the fitting software, and they can see how much of a difference maybe better hearing is helping them with physical activity or with just being more interactive in conversation. So the professional plays a role. They can kind of monitor that and say, hey, listen, I see you've improved 50% over the last 6 weeks. And they can kind of encourage somebody to do something different or do more of this or that. You can also do fine tuning of the hearing aid through the app. So if you go into a noisy situation and it sounds a little bit sharp, you could go into the app, and it's a great application of artificial intelligence because we have something called Signia Assistant that pools data from thousands of hearing aid wearers that opt in to share through the app. And it takes all of their data when they fine tuned and it pools it into the cloud. And then the individual, when they want to tune it, uses all of that data from thousands of wearers to make decisions about what might be the best adjustment the person can make to help address a problem that they have with the devices as far as how they sound.
It's amazing. And so when you're out there, selling the different hearing aids, is that going direct to consumer, or you're doing it through the licensed hearing care professionals?
What I just
how do you support those professionals?
what I just described is through the licensed professional, Signia Assistant. Any Signia device is sold through a licensed professional as a prescription or medical grade hearing aid. And that's different than the OTC that we've been talking about. That's a new thing.
Yeah. So Brian, when you talk about kind of partnering in essence with the hearing care professionals, what does that look like? I mean, the amount of benefits that you're bringing to scale and the market size you all have. How's that kind of partnership look for helping the audiologist or licensed hearing care
Yeah,
professional grow their practice? A lot of them work
right.
solo
Yeah,
or
let me try to
bucketed with
address
other
that.
organizations. Yeah.
I think that it's an interesting relationship, the licensed professional and the hearing aid manufacturer, because one can't do the job without the other. We require their expertise with every individual they fit with hearing aids. And, 95% of people that have age related hearing loss need, at least start with traditional prescription hearing aids. So we work, the two are intricately connected, the licensed professional and the manufacturer. So I think the expectation with licensed professionals is that we bring incrementally improving technology. So every couple of years, we launch a new hearing aid platform, which is essentially a new microchip inside the hearing aid that might process a little bit faster, might have a better noise floor, might bring some new novel type of processing to help people in noise, a better app. I think they kind of expect that we deliver that every couple of years, in addition to firmware updates, which happen every couple of months now, where the feature inside the hearing aid gets a little bit better, or we maybe launch a newer feature with firmware updates. In addition to that, I think they expect, because as a manufacturer, excuse me, you sort of have a broad perspective of the market. You can help people with advertising, with helping them understand what the sort of the trends with consumers might be. Maybe they want a certain type of device. We study that pretty carefully as a company, so we can develop marketing materials using what we've learned about consumers over time. Something in a private practice you wouldn't have the capacity to do. We bring educational support. We have a team of highly trained audiologists on the phone that can help them navigate problems with certain fits, complex patients. So we bring a lot of different tools. I think we marshal a lot of different services to somebody in private practice to help support them in the way they do business with their consumers in their market.
That's really great. Are there any partnerships or milestones that you're particularly excited to share?
Well, I think that we have a new product launch coming up in the fall, and that's going to be a new chip. We have this really interesting, novel, clinically proven technology called split band processing. And I don't want to get too much into the details, but it's a really interesting and unique way to process and try to enhance speech in the presence of a lot of background noise. And we have a lot of data that shows that it's incredibly effective at improving what's called the signal to noise ratio. And we have a new version of that coming out in the fall, which is just more sophisticated in how it splits the split, meaning the sounds from the front are processed differently than sounds from the sides and the back. And so we have a more granular approach to that coming out in the fall. And there's always enhancements to the app. I think we've done a lot of really interesting things around what we call form factors, which are the way the style of the hearing aid. We have a lot of different approaches or different versions of that. Offers more choices. Rechargeable batteries. There's a lot of different options around that, which consumers really like. So lots of innovations every year or so. You can start to see just incremental improvement in all those different areas.
That's awesome, Brian. Is there anything before we kind of close up with you? Is there anything else you'd like to kind of mention?
No, I think that if you're a person with hearing loss today, it's never been a better time to be in the market for treatment because there are an incredible amount of options out there. I think no matter, I like to think that Signia has the best technology, but all of our competitors offer great solutions as well. There's a lot of everything on the market now is pretty effective. A lot of different choices when it comes to styles and form factors and signal processing. We mentioned over the counter. You're starting to see all kinds of different, implantable options for people that have more severe loss. So it's a great time to be in the market for getting help for your hearing. And there's no reason to wait. There's all kinds of evidence that the sooner you get treatment, the better the outcomes over time. And you can stave off cognitive decline. You can keep yourself physically active, mentally sharp, connected with others by pursuing treatment earlier and not waiting.
Awesome. Well, Brian, thank you so much for being with us today. We really appreciate your insights.
My pleasure. Thanks for having me on.
Thank you. And that's another episode. Let's cover that.